Good nutrition is an essential part of creating wellness. Individuals with developmental disabilities residing in community facilities frequently have nutritional concerns that interfere with eating a health-promoting diet. In the first of this two-part video series, Nutrition Guides, attending to individual health concerns, addressing feeding concerns, and mealtime management were explored as ways to achieve wellness. Most nutritional obstacles can be overcome. However, for some residents, more attention to specific nutritional concerns is needed to make the pieces fit. This video will address a few prevalent nutritional concerns. These concerns include obesity, medication and nutrient supplementation, gastrointestinal concerns, and tube feedings. Obesity is a significant problem in individuals with developmental disabilities. People with Down syndrome, cerebral palsy, Prader-Willi syndrome, and other disorders that limit physical activity are at high risk for obesity. Despite the increased incidence of obesity, it can be prevented and treated. Successful obesity intervention and prevention programs include support for behavioral changes, changes in portion size, emphasis on nutritious lower-fat foods, a decrease in sedentary activities such as watching TV, and an increase in physical activity. An effective program will address physical activity, caregiver support, and redirecting behavior in addition to diet. As healthy food choices are defined, ways to say no thank you and a better understanding about the feelings of hunger may also be discussed. Eating is a large part of how people socialize. Parties, holidays, and other special events usually involve high-calorie foods and drinks. Often, candy, soda, or other treats are used as rewards in behavioral programs. Not only do these foods for some add up to a substantial amount of excess calories and weight gain, they also teach the consumer that food is a reward and that eating candy means they behaved well. Non-food rewards such as movies, recreation, shopping, going to the beauty shop, or sports events are suggestions for alternative choices. Preventing obesity need not include restricting intake. Rather, it is making good food choices. The USDA Food Guide Pyramid provides a detailed outline of the balance of foods that make up a healthful diet. The foundations of a good diet are grains, fruits, and vegetables. Next are protein, non-fat milk, dairy products, lean meat, fish, poultry, and beans. Prepare foods simply by baking, steaming, or broiling instead of frying. To minimize the use of butter, gravy, cream, and oil, use chicken or vegetable broth, nonstick pans, and 1% or non-fat milk in food preparation. Fats, syrups, candies, and other foods with little nutritional value but high in calories should be used in very small amounts. Lower-fat alternatives are readily available. However, not all low-fat products are low in calories. Reading and comparing food labels is essential. While there is room for the occasional ice cream or piece of cake, there are many lower-calorie tasty alternatives. Popsicles, fat-free frozen desserts, and angel food cake are all lower-calorie foods that can have a place in the diet. Making changes in portion size and food choice is critically important for people with certain disorders such as Down syndrome, as these individuals actually require fewer calories. Frequently, the expectations for portion size are inappropriate. A quarter-pounder hamburger is just about the amount of meat needed in one day for many individuals. Use the Food Guide Pyramid to help estimate portion size. A major contributor to obesity is inactivity. Sitting and watching TV or playing video games has replaced many more health-promoting activities. Gradually reduce the time in front of the TV. Look for other activities, even if they don't seem to be exercise, such as gardening or house cleaning. Listen to music, dance, go for a walk. Investigate therapeutic recreation programs. Look for ways to involve the body and mind rather than continuing the habit of watching TV. Individuals with developmental disabilities frequently require the use of multiple medications. When and how a medication is given can often affect how well a medication works. Pay attention to labels and instructions regarding medications that need to be taken with or without food, or those that need to be taken with a lot of water. Some antibiotics cannot be taken with milk or other dairy products. Ask your pharmacist if there are dietary considerations with any medication. Long-term use of most medications can lead to nutritional problems. Review medications frequently with a pharmacist and doctor. Some medications can change the way a body uses a vitamin or mineral. Anticonvulsants used to treat seizures can affect vitamin D and folic acid, a B vitamin. Bones can become very brittle with long-term use of anticonvulsants. When using these medications, choose foods high in calcium, such as milk, yogurt, canned salmon, or broccoli. 10 minutes of sunshine a day will also help the body use calcium well. Before considering the use of any vitamin or mineral supplement, check with the doctor, as supplements may reduce the effectiveness of the medication. Diarrhea can occur as a result of cardiac drugs or antibiotics. Offer plenty of fluids and foods to firm stools, such as white rice, applesauce, or bananas. Let your physician know if diarrhea continues more than 48 hours in adults or 24 hours in children. Constipation is one of many gastrointestinal concerns that is frequently an issue for people with developmental disabilities. There are many different medications used to treat constipation. Frequent use of laxatives can actually make constipation worse. It is important not to overuse these medications. Do not use over-the-counter treatments for constipation without consulting a physician. Exercise, plenty of water, a diet rich in whole grains, fruits, and vegetables, plus a regular toileting schedule can help combat constipation. Other gastrointestinal disorders include physical problems such as gastroesophageal reflux. This is when the fluids from the stomach wash over the esophagus, causing a burning sensation while eating or just after eating. Rumination, the process of voluntarily regurgitating food, is a self-stimulatory behavior that can also cause discomfort similar to gastroesophageal reflux. To treat constipation, gastroesophageal reflux, or rumination, a medical evaluation is necessary. Frequently, there are behavioral factors as well as the physical causes. Often, a nutritionist and a behaviorist or a feeding team will work with the physician to facilitate change.
Dr. Joshua? Yes.
Digestive disorders can ultimately be an obstacle to successful feeding. The discomfort caused by these disorders may make the individual avoid certain types of foods, certain textures, or eating altogether. In these cases, tube feeding will need to be considered. Neuromuscular disorders such as cerebral palsy may make a person more likely to aspirate, that is, drawing food or drink into the lungs. Aspiration can lead to pneumonia or death. Therefore, for some people, tube feeding may be the most effective, comfortable, and safest way to provide nutrition. Tube feedings are prescribed by a doctor and are a liquid food replacement or supplement. Short-term tube feeding may be used to facilitate weight gain after an illness or before surgery using a nasogastric or NG tube. The tube is placed through the nose down into the stomach. Long-term tube feeding is usually through a gastrostomy or G-tube. Surgery is required to place a tube through the skin into the stomach. Feedings may be given continuously by use of a feeding pump or may be given as a bolus feeding 5 to 6 times a day. Or feedings may include a combination of pump and bolus feedings. Positioning is critical for the person with reflux or at risk for aspiration. Never feed a person lying down. After a feeding, the tube is flushed with water. There are many types of formula. The type used is dependent on the need for calories, fiber, protein, and any additional concerns unique to that individual. A physician and dietitian will determine which product will work best. Constipation or vomiting should be reported to the doctor. These can be related to an obstruction, the type or preparation of the formula, the speed of the feeding, the size of the feeding, or the temperature of the feeding.
Hi, doctor. My name is Nora.
Often, when a person receives tube feedings, they may also have some food by mouth. Oral feedings can provide stimulation, an opportunity to sit and eat with others, and can improve the quality of the diet. A feeding team and physician's evaluation should be obtained before initiating oral feedings. Nutritional needs are constantly changing. A timetable should be followed for regular reassessment. Extreme changes in a person's eating habits, rapid unplanned weight loss or gain, vomiting or diarrhea over 48 hours needs immediate medical evaluation. A registered dietitian with experience working with people with developmental disabilities may be found by contacting your physician, your local regional center, the American Dietetic Association, or the American Association on Mental Retardation. When nutritional concerns are addressed, the quality of life is enhanced. In this video, we have discussed obesity, medication and nutrient supplementation, gastrointestinal concerns, and tube feedings. These represent a few special concerns in residential placement. Nutrition wellness can be achieved in a residential setting with the successful teamwork of community and hospital healthcare professionals, primary care providers, and the consumer with his or her circle of supports. The companion guide to this video series will reinforce this presentation and will provide additional materials that support nutrition wellness in the residential setting. To wellness.